There's a real problem across the state. We talked about healthcare. There is hardly a free market anymore in healthcare, so the wishes for people who wish we could go back to something like that, I would just urge you to keep wishing. We have developed a system in Minnesota where approximately 60 to maybe 70% of hospitals are facing payment rates paid for by the state and the feds. If they reach cost, you're lucky. Sometimes it's even below cost. We used to cost shift from the private market, which is not very big anymore. And so many hospitals and hospital systems find themselves in harm's way. You don't have to look very far in your own locale to see such a hospital. And they are, as hospitals are deeply dedicated to the services, to the people who need their service. What has happened, however, has more and more consolidation has happened, and more large groups are running hospitals. And despite the commitment of the locals, it seems many decisions are made that are more in the interest of the math as opposed to service. And you have to pay the bills, Mr. President, as every hospital knows. There was a time in the recent past, 10 years ago, and even more recently, where hospitals actually had a profit margin. That is more difficult now between COVID and everything else. And so in my particular area, the hospitals, we're going to close some services, and it was the opinion of many people, including the doctors and nurses who were connected to that, that was actually not a good idea. And so this provoked a whole discussion about how then should we decide if it's okay to close a hospital. In Monoman, the hospital closed the emergency room, or closed the hospital part, because they couldn't, they had very few guests, and it was decided to keep the ER open so you could have emergency services out there. And onlookers would say, like, that probably doesn't make sense. It's too bad there's no services there, but there's no people really going. In other areas, they closed Foston, which was a big stir. Some years ago, the Mayo Clinic closed their obstetric services in Albert Lea, still to the chagrin of the Albert Leeites, where they had to go to Austin to get their maternity care. And so how do you balance the math with the mission? I believe, like, an example of another hospital that's challenged these days is North Memorial, which I believe has a high, strong commitment to mission. And they're in trouble, but they're doing everything they can possibly do to serve the people who need their care. In other cases, it seems like it's more driven by motives that are not so connected to service, but to more of a math problem. And this happened out our way in the Mercy and Unity situation. And so the question arises, who then should be the accountable party to help decide, is it a good idea to truncate services at all? And should you leave it up to the corporations? And I'm not here to bash corporations necessarily, but corporations have a duty to their own, to the people who are running them, even as a nonprofit. And so I'm not even going to go into the corporate questions so much about who's to blame about that, but who should decide? Should the corporation be allowed to decide what they're going to do? As we get more and more consolidation, I'm going to suggest, Mr. President, that someday we're going to have a company called Biz Health, which is going to run most of the hospitals in the state and 80% of the doctors and nurses, and they're going to decide who gets what for health care. That's some down the road, and there's no company called Biz Health, but I'm just predicting the future 10, 20 years from now as things consolidate more and more. And who should decide, Mr. President, that your citizens don't need care in a reasonable distance from their homes and adequate at that? And so it occurred to me, working with nurses and doctors and locals and Representative Kegel, excuse me, it is late, and others, to find a way that would truly be reasonable to do. And the only entity in this state that I could think of, and I would happy if somebody else think me of a better one, is the Department of Health. Mr. President, I have not been a Department of Health aficionado every day of my legislative career. They do some things well. We've had all kinds of discussions. But in this niche, I believe they are the best suited to adjudicate the question, is this in the public interest? Now, when we cite a hospital, there's a public interest review, which takes a long time, and they've not always been successful in deciding. But I think in terms of their stature, and they're generally trusted and with expertise in this, that they should be the ones to decide, is this a reasonable move that will serve the community interest and provide adequate care? And so, just in case in point in the particular local thing at Mercy and Unity, the decision was to close the overnight pediatrics unit. Okay, well, what does that matter? Well, there are cases you need a unit pretty in a reasonable place that's close enough to home. And so you're like, well, just send them to Children's. But Mr. President, what if Children's doesn't have space? And this decision was made without any agreement with any other auxiliary places for people to go. To me, that seems like that's not in the community interest, and I believe it should not go forward. And so what the amendment asks for is that if this particular company, and I'm refraining from using their name in the interest of just being a good sport, they would bring their idea forward that they want to close an operating room and an intensive care unit at one building and close the overnight pediatric service at the other building, and indeed, can they consolidate and have enough room? And will there be enough service capacity to meet the capacity that they've met before? And why is that important to even ask somebody that question? By consolidating and assuming the service controller for a region, they, in my view, they've taken a responsibility and a mission to serve that area. And so, Mr. President, what the amendment calls for is actually an expedited review. This company would then submit, or any hospital, before it truncates services in a notable way, would submit a plan to the Department of Health on their plan and what the alternatives are and so on privately. This would not be a public process. And then they would get feedback and be told, well, maybe you can close, maybe you don't need the ICU, but you need an OR, and you should keep the pediatric beds, but at least you better keep 5 of them. And then that would become the plan that would go forward, serving the public interest. And so this is coming to us, if it hasn't come to your neighborhood, Mr. President, whether you're in Minneapolis or if you're out in Biwabik or Worthington, it's going to come soon, where these decisions come. And I believe that we need to be sure that people get the care that they are expecting to get. And so with that, Mr. President, I'd request a roll call, and I would request a green vote.
Roll call requested, roll call granted. Senator Wickland.
Thank you, Mr. President. Senator Abeler, I appreciate your bringing this idea forward again. We did have a discussion about an amendment you brought forward to our the night that we passed the bill out of committee, and I felt at that time that that amendment needed more work and more definition. And I appreciate that what you've come back with has more definition. I think we heard testimony that day from personnel who work at Mercy and Unity, I believe, and they had very powerful testimony about their concerns about the process that was used to determine closing units and making changes at their locations. And so I do think this is a really important issue that we need to address and try and understand if there is a better way for us as a state to understand when something like this is proposed, what is the impact going to be on the communities. We did include language that was a modified version of the bill that Senator Kupek brought forward that had to do with the hospital closure process, and that is more of a notification and public hearing process. It's not a process where a decision is rendered by another entity like your proposal has. I think my concerns about your proposal are that the clause that says that this would impose a prohibition on the entities taking action if they didn't meet the public interest. And I'm not sure, I think it would need to have more vetting in terms of whether this is legally possible for us to implement in this manner. I have some concerns because we didn't hear this as a bill in committee and have a chance for the entities that would be affected by it to come forward and tell us, specifically what would they have concerns about in terms of being able to develop these action plans that they would submit and the timeline for it, and getting responses from the Department of Health. So I have some concerns about that. And then in terms of the Department of Health, we don't have their feedback in terms of a fiscal note to implement it, although I know you do have a mechanism in the amendment to draw funds from Department of Health. So I'm not saying that it's out of balance. I'm just saying that we do need to understand what it would cost to implement. So I'm interested in continuing to have discussions about it. I have some alternative language that the Department of Health had provided that is a enhancement on the hospital closure process. It doesn't have a decision-making point for the department, but it has some more data collection, and I guess I'd like to discuss that with you as well. Members, I guess my inclination is that if you think that this would be, a process that you'd like to see examined more, I think it's fine to support Senator Abeler, and we will continue to discuss it. I would like to have more discussion about the language and its implications before I say that we would for sure be able to include this finally this year. But I think that the issue is a really important one, and I think members can choose to vote as you feel fit.
Senator Hoffman.
Thank you, Mr. President, and to the good senator from Anoka, thank you for bringing this language. What it really does is it sets the systems to align with future consolidations, and I think it really takes a look at lessons learned from the past, and it's so good to hear Senator Wickland talk about, yeah, this is worth having a discussion. So it sounds like that, and I just would support people to support the senator from Anoka and looking at what we can do. Both the M&A and the doctors' unions have said this is the right direction to go, so please vote green.
Senator Nelson.
Oh, thank you, Mr. President. Members, I appreciate Senator Abeler bringing this amendment forward and this concern forward. I think we all share the goal and the actual desire that we can ensure that all of our communities have access to the hospital care when they need it, the excellent hospital care that is needed. But I have some additional concerns. I listened to the senator from Bloomington, the chair, list off some of her concerns, like there's not a real fiscal note here. We don't know exactly we don't have any idea really what the cost would be. And there is also the concern about this late date, where we are trying to wrap up session. But I think the broader concern of mine is the fact I don't know how this amendment would actually be helpful. I don't know that it would be helpful at all in forcing a business, in this case, a life-saving business many times, to stay open when there is not the patient census or the ability to pay for the care that's needed when it's needed. And also, there is a concern, too, regarding the safety if, in fact, the hospital is not being used as much as it would need to, or it's not able to provide the type of care the patients need and when we think of hospital care, we think of those often emergency cares that need to be taken care of right away. And so I am just concerned that it's a well-intended amendment. I think it could have harmful effects, maybe just the opposite effects of what was intended. And then to the chair's point, you know, this bill, this amendment, it was never introduced as a standalone bill even. It didn't have, I don't believe it had a hearing. And I think it is so important that Minnesotans have access to hospitals that are able and capable to take care of the needs that are presented, and that hospitals that are able to stay afloat, so they are going to be there in the future as well. So I have a few questions for the senator from Bloomington, if she might yield.
Senator Wickland, will you yield? She will yield. Senator Nelson.
Oh, thank you, Mr. President. Well, I think you might have mentioned this, Senator Wickland. I'm just curious, has the Department of Health weighed in on this proposal, and what did they say? What's their feedback been?
Senator Wickland to the question.
Mr. President, Senator Nelson, we became aware of the amendment in this form only this morning, or well, yesterday morning. And so we asked for some feedback. I think, you know, we got some concerns about not knowing exactly how frequently they would be needed to respond to these action plans and reviews. And so that would make it challenging to figure out exactly what the cost would be. And then just, I guess, some general thoughts about how many people that it would take to implement. I would have to look back at my notes, though, for other statements that they made.
Senator Nelson.
Thank you, Senator Wickland, Mr. President. So it's a relatively new, it's a large proposal with significant outcomes. I would suggest that this is something that is just not ripe and ready for this time. But again, the need is great, and we have to figure out how we can have the health care that's needed, where it's needed, when it's needed, and in a way that is affordable. I am concerned that currently, I don't know that the Department of Health has the time nor resources to actually achieve the goal here. I think the language has been, it sounds like it's been poorly vetted. And as I said, it wasn't introduced as a standalone bill. So my hope is that we will continue looking at how can we make it so our hospitals can continue to operate and can continue to serve patients. But sometimes it's a difficult environment. In fact, I don't know of hospitals that close because they want to close. Certainly it's because there's a lack of patient census. There's just not enough patients. And how are we going to handle that? I think it's a real concern. I just don't think, number one, this is ready for prime time yet. And I think the question should continue to be looked at, but I would encourage a no vote on this amendment tonight.
Members, we're on the A80 amendment. Senator Gruenhagen, please reframe your comments to the A80, please, sir. Senator Gruenhagen.
Thank you, Mr. President. Yeah, I see some of the concerns that Senator Nelson said, but I do think Senator Abeler is trying to help in a very difficult situation. And when I look at this amendment, it's a Band-Aid from my standpoint. You know, Senator Abeler did reference the information sent out by the lead lobbyist to the Minnesota Hospital Association, and I was invited to a Zoom meeting with about 6 CEOs from major hospitals in the state of Minnesota, 2 from the metro and 4 from the rural. And, you know, the lead lobbyist said, we have 67% of the hospitals in the state of Minnesota losing money. Okay? Let that sink in. 2/3 of the hospitals of the state of Minnesota are losing money. And Senator Abeler, with this amendment, is trying to put a handle on it. Unfortunately, this will be a Band-Aid. It's managed decline is what it amounts to, okay? And actually less access. So I'll just share with you what the 6 CEOs told me and other people on the Zoom meeting. They said that for every $2 of expenses, they get reimbursed about $1 from Medicaid and Minnesota Care. So $2 of expenses, they collect on average $1. From Medicare, they collect $1.50 for every $2 of expenses. So they still lose money, not as much as under Medicaid. On private insurance, they get $2.50 average reimbursement, according to these CEOs, for every $2 of expenses. So they actually make money to cover their expenses. The problem is, members, we have the baby boomers are retiring. You're having a greater and greater percentage of government reimbursement and less private insurance, which unfortunately the federal government and some of the state has seen as the enemy, when in fact it is the friend of the healthcare system. So members, this amendment, again, it's a Band-Aid that basically does manage decline. If you want to solve the problem, the CEO of Rochester Mayo several years ago, talking to the President of the United States, it was the Stars Tribune, and I cut the article out, is on the front page. He said that the Mayo was considering not accepting government health care patients. Okay? Now, he was heavily criticized, and he retracted that statement a few months later. But think of the CEO of the Mayo system in the state of Minnesota, one of the best in the world, stating that they were considering not accepting patients on government reimbursement. We have to reinvigorate the private sector if we hope to maintain a healthcare system that's given us the services and medical miracles that we've seen. Going with more government-run healthcare is only going to create this amendment, which is going to manage the decline of our healthcare system. And we're ultimately going to wind up with a two-tier healthcare system, one for the rich and the privileged and a second-rate one for the rest of us. That's the direction we're going when we rely on government to solve our problems. Please come to your senses. We want to keep access for yourselves, your children, and your grandchildren. But more government is not the way to go. We have to reinvigorate the private market. Vote your conscience on this amendment. It'll probably slow the decline, but we're still going the wrong direction. Thank you, Mr. President.
Senator Lucero, we're on the A80 amendment. Senator Lucero.
Thank you, Mr. President. I sincerely appreciate these conversations, and I know that these are tough, and I appreciate Senator Abeler bringing this and having this conversation. And I am intently listening. I'm listening to Senator Wickland. I'm listening to Senator Gruenhagen and others. I was in the car here on a drive about a month ago or so on a Saturday, and I listened to a radio program, and I heard a term I'd never heard before. And it was, and Mr. President, maybe you've heard this, the term, I quickly looked it up here just to refresh me, Peak 65. And if you haven't heard Peak 65, just very briefly here, this is one article. In 2024, is a record-breaking year for retirement in the U.S. And what Peak 65 is referring to is an average of 11,000 Americans per day are expected to hit their 65th birthday starting, I think it was April of this year through the end of this year. 11,000 per day. And then it goes on to say that's approximately 4.1 million Americans are turning 65 every year beginning this year through 2027. So peak 65. So what does that mean? Think of all the healthcare issues that are going to come up with, obviously, the natural aging process. And we're hitting that peak 65. And so I think about that. And then I think about a conversation I had maybe 6 weeks ago. A constituent group came in. I think it was MNA Day on the Hill, if I remember correctly. So the nurses came in. I'm guessing there was approximately 8 of them came into my office. And among their top priorities in their legislative list was hospital closures. And so in the group of 8 or so, 8, 10, I think 3 might have been my constituents. Others were from other parts of the state. And those M&A nurses that were in other parts of the state were describing hospital closures. And they were going on and explaining the negative impacts that have on the community, the hardship that causes. And I don't have the background in health or hospitals or any of this content, which is deeply complex, which is why I very much appreciate and rely on the skill and the experience and knowledge of others, and why I'm listening to Senator Wickland and Senator Abeler. So I guess I want to ask Senator Abeler a question if he's willing to yield.
Senator Abeler, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President, and thank you, Senator Abeler. So, because again, there's a lot of moving parts and a lot of things that I don't have experience with in this, is my recollection of the MNA nurses and speaking about hospital closures and the drivers for the hospital closures, as I heard one of the drivers, Senator Gruenhagen just referenced, was obviously losing money. That's going to be exacerbated by the peak 65 and the additional health that's going to bring. If they're losing money with each patient, that's a concern. Is your amendment dealing with, and obviously I have no idea if you met with MNA nurses on MNA Day on the Hill, but I'm wondering, is the hospital closure, if indeed you did meet with them, is this amendment dealing with that issue that they were concerned with?
Senator Abeler, to the question.
Well, thank you. And this is all about closures of hospitals. Hardly ever close all the way. They may close. I have to look at the president. Sorry. Actually, I'd rather do this. That's a House thing. So the hospitals hardly ever close the whole hospital, but they may close a service. They may close. They may downsize a department. So it's practically much smaller and insufficient. I think Senator Gruenhagen had talked about managing decline. The question is, do you want to manage the decline or do you want to not manage it? And who should manage it? And do you want it random or do you want somebody to look over it? And so if a hospital has to close, well, then it probably does, but it should close for reasons that make sense. And then you have to figure out a way how you're going to serve the people that are left. And that's the intention of this, if that helps answer your question.
Senator Lucero, we're on the A80 amendment.
Thank you, Mr. President, and thank you, Senator Abeler, and thank you, Senator Gruenhagen. I honestly have no idea how I'm going to vote on this. I don't want to just manage the decline. I want to have a solution so that we don't have hospitals closing and then having to figure out whether it's a whole hospital or whether it be, as Senator Abeler just said, a closing of a service, a particular offering of service that might force residents in rural Minnesota to have to drive 50, 60, 100 miles to obtain a similar service. I hate that we're even in this position. I hate that we even have to have this conversation. It was a tough conversation with the MNA nurses. It was tough because I don't have a solution for this, but it certainly is one that we don't want for Minnesota, and it's something that Minnesotans should not have to contend with. We shouldn't have to deal with driving 60, 100 miles to a service. We shouldn't have to deal with what are we going to do to close hospitals, put controls in place to slow down the decline or closing of services or ceasing of services. Instead, the conversation should be, what can we do to expand? How can we improve? What can we do to make sure that Minnesotans have accessibility to the greatest degree possible? And so I hate that we have to have this conversation, but I value and appreciate those that have greater experience as I'm listening so I can and hopefully make the best choice on this amendment. Thank you.
Members, the last voice we're going to hear will be that of Senator Abeler, who is, Senator Liskey.
Thank you, Mr. President. Mr. President, I had no intention of speaking to the amendment, but it's definitely been a good conversation so far tonight, and I think that's something that's important to me, and I wanted to kind of address maybe a bunch of different ways of looking at this amendment as it is. From the problems that Senator Abeler is trying to address, I wholeheartedly feel the same issues. I have experienced this in my own district. Portions of the Mayo Clinic system in New Prague have shut down different departments, different parts, without much notice, normally about a month at the most, maybe a couple weeks. We had a clinic system close in our small town of Lonsdale with about a 2-week notice, and it was posted on Facebook. It wasn't sent out to patients. It wasn't something that was brought up. So when we're talking about rural access, I wholeheartedly feel the need for something like this. My concern is that this specific amendment may not actually approach fixing that issue. A lot of times, just having to report it to somebody else and them telling you, no, you can't close even though you physically can't stay open, I don't think that solves this problem. And I think that's part of the issue that I have with this amendment, because it's more of a mandate telling them they can't close than it is a help find out why they're closing. And so with that, I'm hopeful that we can work together, Senator Abeler, on finding the actual solution to the problem. Unfortunately, I will be a no vote on this. Thank you.
Senator Johnson.
Thank you, Mr. President. Appreciate the amendment coming forward here, Senator Abeler, and what you're trying to do here. I, too, had a hospital and actually am going through a similar situation in my district, little town of Foston. But as we continue to increase the mandates on our hospitals, as we continue to make healthcare costs more and more expensive, the economics of these areas is getting more and more difficult to sustain these healthcare operations in those areas. And I agree that we need some improvement on when significant changes to our healthcare within our local communities is being affected by decisions of healthcare systems. There needs to be a process. Currently, the process is broken. I will admit that, and it seems like our communities are being affected by that, and people are being, their health care is being interrupted by that. But I think the answer isn't simply giving the authority of regulating how businesses, how these healthcare systems are making these decisions, giving that authority over to MDH into some sort of subjective review. I think what we really need to do is pare this back and figure out what sort of regulatory framework that we can put into statute would help give a real guide path for making these decisions. You know, I know there is some notice, but I don't know how much teeth is involved with that notice and how much these healthcare systems actually have to comply with what little is there in the regulatory framework presently. And so instead of taking this easy route and just saying, MDH, you figure this out, if you determine that it's within the public interest, has an operational impact, if there's adequate time, that sort of thing, why don't we put that into a statutory framework to do that and actually do our job instead of burdening the executive branch with more work. And so for me, I'm with you, Senator Abeler, on the need to do something. However, I think we can do that in-house with the input of our healthcare providers, along with the stakeholders involved with that, to bring a bill forward that would do what we need to do to give clarity to the systems as they make these major business decisions in healthcare across the state.
Senator Uckey and then Senator Abeler.
Thank you, Mr. President. And Senator Abeler, I know your heart's in the right place when it comes to this. You, like all the rest of us, care about our local providers, and we'll do everything possible to make sure that they succeed and keep them around. But on this particular amendment, I have to oppose it. There's a lot to this process. I started out this bill hearing a number of hours ago and said, we need to address this whole big problem. We've got a lot of challenges in our healthcare industry. We need to have some serious conversations with all parties and come up with something that's more workable, because we kind of keep nicking things around the corner and we're not going in the right direction. Our providers go to work every day to help us. They show up to help us and cure us and treat us. The last thing they want to do is shut down a service they offer or a wing of their facility. It's a business decision. They just get to the point where they just can't operate anymore. And this is putting government in the middle of private business, and I just don't like that. So I would encourage everybody to bring an amendment back like this in the bill form next year. We got a chance to see the other offering come to our markup night for our bill, so it's a quick amendment. We look at it and see that there's a lot more that needs to be talked about. It's kind of that same thing here. I would encourage some further discussion, but at this point, I would like to see it stay out of the bill. It needs more discussion. First of all, it was never in a bill. We all know that already, and we don't have a fiscal note. I'm hearing that there's a sizable cost to MDH, and I think we need to know those things before we just move something forward. So, and then it boils down to, and we just heard about the Peak 65, and that kind of falls right in play with how our providers receive most of their pay nowadays. It's Medicaid and Medicare. Both are subpar payers. They don't reach up and pay the cost of the procedures, the cost of doing business. That whole equation has got to be brought back in, and we got to figure out how to make this work. But I don't see this as a helpful move. We don't need to tie the hands of our providers. We need to encourage them. We need to help them succeed and do all we can to keep their doors open. So thank you, members. And I would encourage a red vote.
Senator Abeler, you are the last speaker before we vote.
Well, thank you, Mr. President. I actually wish there were more people on the floor to discuss this. I wish this was not 1 o'clock in the morning on this particular topic. So let me explain to you what happens when one of these organizations is going to close a part of your hospital. They decide they're going to do it. They inform the staff, and they have a meeting, and they take comments, and then they do it. At the meeting we had for Mercy, in particular, closing the pediatrics overnight unit, there was a parent who popped in. Most of the testifiers were actually professionals working at the doctors and nurses who actually I thought were really concerned about what was going to happen. But the man talked about his child, I don't remember if it was a daughter or a son, under age 1 who had some emergency and came to Mercy ER, and they had a bed to put him in, or her. And they could have gone to Children's, which would have taken another hour, and they went into Mercy, and they made the trip down to Children's, the baby would have died. All the doctors agreed that it's lucky they had a bed to put him in, or her. And so when that story came up, the corporate officers were like, oh, well, thank you for sharing that story. And how many stories like that do you think that we ought to have? And do you think that God bless corporations, but we've moved more and more into corporate-run healthcare and less on the mission side. And do you think it's reasonable that a company can decide they're going to close because of whatever reason they don't need this service anymore, and then not have any available anywhere in the metro? Take them to Children's. But this particular company did not even have an agreement with Children's to have 2 beds, 4 beds, or 5 beds, or get some kind of priority care. Is that responsible? Yeah, the amendment it's kind of new. The topic is not new. The solution, we've been trying to work on this between the Representative Cagle and myself, given our situation. But in June, there's not going to be a pediatric bed in the area between Children's and St. Francis, and I don't know where the next one is going north. Is that something that we think should just be allowed to happen? And if it can happen in the metro at Mercy, and what's going to happen in Worthington or Winona or elsewhere? And so, yeah, is it a perfect solution? I don't think so. But I think it's a pretty good idea to have somebody besides a corporate entity who is worried about their math to decide we're not going to have a pediatric bed between Children's and St. Cloud unless we're fine with that. Like, oh, well, and so we talked about it, and it's kind of new, and I'm nervous about it, and well, how will it work? Or instead, we can decide, let's put this bill this amendment into the bill and keep working on it. I've been here long enough to know if there's something in a bill, it gets worked on. If there's something outside of the bill, you talk about something else. And that's my concern. My concern in my situation is that when you talk to the OR nurses at Unity, they say, well, it's not even working. And there's not room at Mercy. They miscalculated the capacity. So who gets to decide that? A company who's worried about the math, and the math matters, Mr. President. And so how do we, but there's got to be mission, there's got to be capacity. And as these places close, they're not going to come back. And sure, they're private nonprofits, they benefit by all kinds of laws we give them. And so, but if we need to have a way that we can agree on that makes some kind of sense besides doing nothing. When this session comes and goes, by the time June has come, there's going to be no OR in Unity, there's going to be no ICU at Unity, there's going to be no pediatric beds between Children's Hospital and St. Cloud. And that bothers me. But it's a broader thing than just my little local. It's going to go somewhere else, and people are going to find themselves with a card that doesn't even have a hospital where you're nearby for the urgency you need. And so is it time to wait for the process to come up with some magic answer we have meetings about? This is not any assault on the hospital association or hospitals. This is a way to preserve the integrity of the healthcare system, and then we can find a way to support the hospitals in the meantime by rebasing them, by helping them get their beds unloaded. But if the beds are closed, they're not going to come back. So members, I have not talked to all of you. I've only talked to a few of you about this. The discussion maybe has been in the hallway with various people. Please give this amendment a chance. You heard from Senator Wickland herself. She's open, and I will predict it will not come back harmful with somebody as responsible as her. But if it goes in, it has a chance to get done. If it doesn't, then sorry to the people who want a pediatric. Hope you don't need a bed for your child anywhere in the North Metro. Please, members, vote green. Thank you.
The Secretary will take the roll on the A80 amendment. Members, please vote. Senator Morrison? She needs a minute. That's understandable. Members, please vote. Senator Morrison, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes aye.
Senator Bolden votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umover Baden votes aye.
Senator Umover Braden votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
And Senator Zhang votes aye.
And Mr. President, Senator Dietzig votes aye.
And Senator Dietzig votes aye. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Barr votes no.
Senator Barr votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Draheim votes no.
Senator Draheim votes no.
Senator Housley votes no.
Senator Housley votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Weber votes no.
Senator Weber votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
And Senator Howe votes no.
And Senator Howe votes no. And Senator Duckworth, you can vote. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 31 noes, the A80 amendment is adopted. Senator Abeler, do you have another amendment? If not, I have another person to go to.
Thank you, Mr. President. I think after that I should quit while I'm ahead. I want to thank people for their confidence in that last amendment. I really respect the discussion. And Senator Wilkton, thank you for that. Thank you.